Opponents of reform have spent millions of dollars spreading misrepresentations, in fact, even mistruths. But the truth is, Democrats believe that health insurance reform must strengthen Medicare, never harm it. That is why our health insurance reform legislation will improve care and benefits under Medicare and extend Medicare solvency.
Republicans created the donut hole in the Medicare Part D drug benefit. That is the gap in coverage, over $3,600 a year and growing every year, that seniors are forced to pay 100% of their medication plus the full cost of their premiums. Millions of our seniors fall into the donut hole each year. They're forced to cut pills in half, skip doses, or go without medication altogether. The Republicans created the donut hole, and our bill begins to close it.
Now, we believe that the reform legislation that has been passed by the Senate lays a strong foundation to build on to meet the priority needs of older Americans, and AARP is especially encouraged by the leadership of Speaker Pelosi and her colleagues in the House to make sure that any final reform package includes a measure to close the Medicare prescription drug coverage gap known as the donut hole. This is the top priority of our membership.
Insurance companies have failed to provide the affordable insurance for many Americans, especially early retirees. In my own district, I know lots of people who have retired in their 50s and early 60s, some by choice and many because their company went out of business. Many lose access to their employee-sponsored health insurance and are forced to go into the private insurance market. The only option for some is private insurance, and insurance companies are charging an arm and a leg for that coverage. We owe it to those retirees to give them a better option.
The Center for Medicare Advocacy urges Congress to pass health care reform now. The legislation will strengthen Medicare, realize the promise for health coverage for younger people, and increase the economic security of all Americans. It is a matter of fundamental fairness.
Right now, we face a shortage of primary care doctors in our country that is exacerbated by the high cost of education, which pushes more and more medical students into specialty fields and strains Medicare. Today, about 12 million Americans lack access to primary care doctors in their community. By providing immediate support for primary care physicians, we can help minimize these shortages and restore the promise of Medicare.
And I was struck as the hours went by with motion after motion after motion that was brought up, that our Republican colleagues once again really showed their true colors when it does come to health care for seniors and for American families. And they opposed and they voted against motion after motion that would protect seniors' health, that would shore up the Medicare Trust Fund, that would bring down that cost of health insurance, close the prescription drug donut hole. And again, as I've already been pointing out, they created the donut hole in 2003. What does that spring from? Certainly not a reflection of the values of this great country, which is demonstrated by Social Security and Medicare and Medicaid. But what was palpable was their disdain for those programs. And we know what those programs have meant in the lives of the American public.
Now it's time to say whose side we're on. I wish it didn't come to that. We like to think that everybody in our country is on the same team. But apparently that is not the case when the vote over and over again in this Congress and these committees and the rest has been to be for the insurance companies, to have them continue to come between patients and their doctors instead of advocating for the change that our country needs. Senator Kennedy said it best. It's not just about the provisions of the bill. They're important. It's about the character of our country.